Over the last century, psychologists, psychiatrists, and other mental health professionals have made an amazing discovery that by interacting in particular structured ways with another human being, it's possible for people to reduce their psychological symptoms, to address longstanding difficulties, and to experience more happiness. As you know, given that you are listening to this course, this structured way of interacting with another human being is psychotherapy. We've discovered that psychotherapy is not a panacea. It requires work on the part of the patient, but it does offer the potential for change. So in this first lecture, I'm going to share a little bit about my background as a clinical psychologist. I'm going to introduce you to some important terminology in thinking about therapy. I'm going to let you know what you are going to be able to learn from this course. And then finally, I'm going to present a detailed case history of a particular person, Paul, that I will refer to throughout the course. I've been teaching a course on psychotherapy almost every year since 1995. It was the first course I ever taught as a graduate student at the University of Minnesota, and it remains one of my favorites. Why is it one of my favorites? What I like about thinking about therapy is that it forces us to grapple with how we understand basic questions about human nature, how we define health and wellness, and how we think about abnormality and psychological disorder. I also really enjoy teaching this class because it gets us thinking about how people can make productive changes in their lives. That's an issue that nearly all people find compelling. So I am a clinical psychologist by training. Clinical psychology is the subfield of psychology that's focused on describing, assessing, and treating psychological disorders, conditions like depression, ADHD, eating disorders, phobia, alcoholism. And I've worked with a wide range of people. I worked, for example, at a free walking clinic for adults where we never knew who might come through the door any particular night. I've worked with children in a pediatric clinic. These were children with serious medical problems like cancer who needed some extra support. I worked in an inpatient unit with hospitalized children and adolescents. I worked for a time doing assessments of men who had been accused of sex crimes. And my own particular interest over time grew to be a focus on children and adolescents and how to work with them and with their families to help them change. So I'm excited to share some of those experiences with you in this course. I want to note a few pieces of terminology before we begin. So first, what do we call this person who's seeking help through therapy? Sometimes, and traditionally, this person has been called the patient. That was the language that people who practice psychoanalysis used. And it suggests with a patient that there's some underlying issue, some dysfunction that the person has that can be remediated through the process of therapy. But then later, some clinicians began to change the word to client, which was designed to depathologize the person who's seeking help. It was designed to suggest that there's not necessarily something underlying that's wrong, but rather this is a person who just needs a little bit of help and assistance from someone else. I think both terms are good, both are relevant in different ways, and so you'll see that I use them interchangeably throughout this course. I'm going to present some cases of people with whom I have worked, and in every case, I want to provide reassurance that I'm changing the name and I'm changing some of the details to maintain the confidentiality of the people that I worked with. Throughout the course, I'm going to discuss a wide range of disorders, all kinds of different conditions. It's a little tricky because I can't spend a lot of time explaining in detail what these are, but I will try to offer enough information about each of the conditions so that my examples will make sense to you. And finally, and most importantly, I'm going to try throughout this course to emphasize the relevance of this material to your daily life. I want to encourage you to think about how to apply the material that we are covering. You may find that you get more benefit from listening to this course by trying deliberately to make a change in some aspect of your own life over the next couple of weeks. You can try implementing some of the ideas that we talk about here to make changes of all kinds, circumscribed changes in habits that you might have, your cell phone use, your exercise habits, or maybe you want to try to change something more significant, for example, the way that you relate to particular groups of people.